she can see me.
Shauna with you.
No, she at my sister's house. Hi, my name is Nicole Bashiri, Family and Consumer Sciences Extension Agent in Bath County, but currently I'm in Menifee County, and we are doing our monthly Medicare Minute meeting today. We're going to be talking about veterans. So Saskia Hollenberg, she's the person who's been doing this for the last couple of months. She's going to introduce herself and get started. So thank you, Saskia, for working with us today.
Thank you, Nicole. I appreciate it. I'm going to share my screen and we go right into it. Let me see. There we go. Thank you, Nicole. I appreciate it for having me here again. And I really appreciate the opportunity specifically today to share a subject dear to my heart, help for the veterans and Medicare and veterans. So just a couple things about myself real quick here. Oops, it's not forwarding. There it is. I'm an independent broker and I have active insurance licenses in the state of Ohio, Tennessee, North Carolina, Idaho, Virginia, Michigan, Florida, and sure enough, our beloved Kentucky. I love to help people as much as I can. I love to share information about Medicare. My background originally is in management. I manage different companies. And personally, I live in P-Sticks in this beautiful little part of Owingsville. For most of you guys know me, I'm from Germany, coming from the mountains, Bavaria. We have horses and dogs, rescue dogs, and a ton of chickens, and I love to garden, to can, and horseback riding. Here is a couple impressions from my personal life, so you get a little bit to see my horses here, the dogs, our chickens, and here's my brother. He's in Germany. And a couple testimonials from clients I helped. And then we dive right into it. Why is, for me, is it so important? Why is this subject, veterans healthcare, is so dear to me? Is I grew up in Germany and I grew up in the American sector, which means I grew up under American occupation. And for me, it was very important. My mom always told me we need to thank our soldiers. It is, you know, they keep us safe here. That said, I'm sure if you are not yourself a veteran, I'm sure you have somebody in your family who is a veteran, who has served. So a thank you, please, to everybody and to the families. So what we're going to address today here is how is Medicare working with VA? And I give you also a little bit of an overview, general information, Medicare eligibility, what Medicare is, Medicare options and important dates, and some costs and some other information. Excuse me. Now, to determine if you qualify for VA healthcare, where do I go there? Where are you going? So you could go to the nearest VA medical center or clinic. You can bring a signed application for health benefits. It is the Form 10-10EZ. You can find that online. You can get help through the State's Department of the Veterans Affairs. You can apply by phone. This is probably one of the options with COVID going around. The phone number is here. If you need these informations after we're done with our presentation, please send me a PM and I will forward you that information. You can also apply by mail with the Form 10-10EZ and send it to the address here, Health Eligibility Center in Atlanta. Now, where can I find help applying for VA disability benefits? Veterans Service Organization, there are in all 50 states and Washington, D.C. And these are including the Veterans of Foreign Affairs Wars, American Veterans, the American Legion, the Disabled American Veterans, National Association of the County Veterans Service Officers. Now, they are not in all states. So who is eligible for Medicare? If you are within 3 months of turning 65, you're eligible for what's called an initial enrollment period, and you can enroll in a Medicare plan. Excuse me. At age 65, you may be eligible for Medicare Parts A and Part B, even if you still work. So these things always, people are coming to me with questions, can I get it? Can I deny it, etc. You may be eligible for premium-free Medicare Part A through your spouse. Also, you will still have to qualify by age or disability. You may also be eligible for Part B, Part A and B if you are under 65, if you have certain disabilities or end-stage renal disease. What is Medicare? A lot of people know Medicare is there, but really, where is it coming from? How's it working? It is actually one of the largest health insurance programs through the United States government, and it serves currently roughly around 62 million people. It is run by the Center of Medicare and Medicaid, short CMS. And you might hear that from people. It is reported by CMS, etc. This is the Center of Medicare and Medicaid. This is part of the U.S. Department of Health and Human Services. Medicare is divided in different parts, and we're going to go into detail in a minute. We have Medicare Part A and Part B. Then there is Medicare Advantage. It's also called Part C. And then there is the prescription drug coverage called Part D. Medicare Part A and B, they're offered by the federal government, and original Medicare covers much, but not everything. And again, especially people who have not been on Medicare, who are turning 65 or who become eligible for Medicare, they are not aware that it's not everything is covered. So generally, you will see some co-insurances and deductibles. What does Part A cover? Part A covers hospitalization, skilled nursing facilities, hospice care, and home health care. Part B helps with the covering of doctor appointments, outpatient care, preventative services, some screenings, occupational physical therapy, home health care, but also under Part B falls under observation days in the hospital. And this is often overlooked. So when you are getting into a situation where you need to see an emergency room, the doctor says, we keep you here for a day, then you need to double check always if it's admitted or if you're under observation. If you're under observation, it will fall under Part B, and the copays and deductibles will be different than under Part A. Then there is Medicare Advantage. It's called also Part C. Medicare Advantage may include extra benefits, also may include prescription drugs. It always covers Part A and Part B, and additional services could be dental, vision, wellness programs, but over-the-counter programs, over-the-counter benefits, hearing aids, etc. So when would you choose a Medicare Advantage plan instead of original Medicare? You must have both. You must have a Medicare Part A and Part B to be even eligible to pick a Medicare Advantage plan. So if you only have Part B, you would not be able to elect a Medicare Advantage plan. You usually have to pay an additional monthly premium, not always, but there's always exception to the rules. You remain a Medicare member as long as you keep your Part B premium paid. That is important. Along with a Medicare Advantage plan, you may have an opportunity to purchase additional supplemental benefits like dental and vision coverage for an additional premium. The types of Medicare Advantage plans, we're going to address these briefly. There are health maintenance organization, and you probably know it better under short HMOs. The HMOs usually require that you pick a primary care physician, that the primary care physician will send you with a referral to a specialist if this is needed. And you will have to stay in the plan network. You will not be able to see a doctor outside the network, even if you prefer to pay cash. Then there are preferred provider organizations, also called PPOs. Here you have a lot more flexibility. You can choose any provider that accepts Medicare. Now, when you go in the network, your copays are typically lower than if you choose to go outside the network. Then there are private fee-for-service plans. Generally, there's more freedom to choose providers, but there's still network arrangements they need to be observed. I do really have not seen a lot of the PFSS plans. Typically, what I normally see with my clients are HMO and PPOs. Also, at something what I see quite often, what I work with my clients quite often, are special needs plans. These special need plans are tailored for following situation. One is chronic conditions like diabetes or heart conditions. Now, I will say not every county, not every zip code has special needs plans for chronic conditions. So that is something where you might want to just ask and say, hey, do we have in our county here, in Bath County, for example, do we have any chronic condition special needs plans? Then there are plans, they're called dual eligible plans or DSNP plans. They are for people, they have Medicare and Medicaid. And Medicaid will be then a state assistance. And then there are institutional SNP plans. They are available for folks who are needing long-term care or skilled nursing. Medicare Advantage plans have usually more benefits. The minimum what these plans have to cover is what original Medicare covers. That is always the minimum, but they always can add on more benefits. For example, fitness and rewards programs, vision coverage, dental coverage, access to mail delivery pharmacy, which I see currently with COVID. A lot of my clients are taking advantage of that, so they don't have to go to the pharmacy. And then also an over-the-counter allowance. What is an over-the-counter allowance? Over-the-counter is when you get a certain amount of money every month or every 3 months, and you can spend that on items like aspirin, like Band-Aids, like vitamins and things like that. Then we have the prescription drug plan, also called Part D, and they are offered from private insurance companies. We have over 20 different prescription drug plans in the state of Kentucky, and these change every year. And as you already know, Center of Medicare will have to approve them, and we'll need to make sure that the formularies are correct, etc. And they change every year. Then we have in the prescription drug plan, they are offered from private insurance companies, but they are required by federal law to offer the basic benefits offered by Medicare. And Part D plans have, each plan has their own list of prescription drugs. So just because one plan is covering one prescription does not mean all the other plans will. So it is always important to double check what is covered. Is your prescription covered with that specific plan? Excuse me. I think the weather is getting to me. It's getting so cold outside. We have 2 options to cover your prescription drug part, and that would be with the standalone prescription part that is called also PDP, or you can get your prescription covered through a Medicare Advantage plan. And what I said earlier, Medicare Advantage plans have often a prescription plan included. If you enroll in a Medicare Advantage plan with a prescription coverage, you do not need to add a standing alone Part D plan. If you decide not to join a Medicare prescription plan or a Medicare Advantage plan with prescription coverage, when you get first eligible and you do not have other credible coverage, like for example, through your work, through group insurance, or through the VA, then you may be penalized with a late enrollment penalty if you join later. One question I always get from all my clients, well, I want a plan without the coverage gap. All prescription plans will have a coverage gap. It's also called the donut hole. And during that time, you will have higher percentage of your prescription costs. You can move in or out of the donut hole or coverage gap when your total cost reach specific dollar amounts. The donut hole depends on the specific dollar amount, what is set by Center of Medicare every year, and that's when you hit the donut hole. So it's not from the very get-go, but at a certain, when you reach a certain amount of costs. What are your Medicare options? I give you here, there are several options. You can stay on original Medicare, where you have your Part A and your Part B. You can add to original Medicare a Medicare supplement and a standalone prescription plan. Or you can go with a Medicare Advantage plan, which is original Medicare provided by a private insurance company and a prescription drug plan included. So as you see, this is not on top. These two things are together. There are also Medicare Advantage plans available without prescription drug coverage. And typically I recommend those for my veterans because they often get their prescriptions at the VA. And then we can go with just straight original Medicare and a prescription plan. Now, special needs plans. I already touched briefly on that. These plans actually offer normally benefits, and they're more focused and specialized on the healthcare of certain situations, as well as the prescription lists are often designed to meet specific needs. We already talked about this. There are the chronic condition ones for diabetes and heart conditions. And then there are the dual eligible ones for people they have Medicare and Medicaid. Here's one thing I would like to bring up is that I see a lot of people there are actually not aware that they would be eligible for the assistance from the state. So if you are not sure, give me a call, text me and say, hey, can we look that up? Okay, we can definitely look into this. And then I can also help you with the application process. And then again, for residents in certain types of institution, like nursing homes, skilled nursing facilities, we have the institutional special needs plans. Where I see a lot of confusion is often that I'm hearing, oh, I have a supplement, and they actually mean I have a Medicare Advantage plan. So there is a difference between a Medicare Advantage plan and a Medicare supplement. They're also called Medigap plans, and they work with original Medicare. They are designed to help pay some of the costs of original Medicare do not cover. Original Medicare has co-pays and deductibles. They are not covered. The Medicare supplement plan will help to cover these. Each supplement insurance plan has a unique blend of benefits. So again, we would have to sit down and look at the ones you might be interested in. Enrolling in Medicare and it is the time. It is almost here. If you are already a Medicare member and you're enrolling in a Medicare Advantage plan, you can change your Medicare Advantage plan, or you might renew it. You might want to review it because of the changing prescription situations, and that is during annual enrollment. And it's coming up fast, October 15th to December 7th. If you are enrolling in Medicare for the first time, you have what's called an initial enrollment period. And this initial enrollment period is 3 months before you turn 65, and the date your new Medicare Advantage plan or your Medicare will be effective will be the first of the month you're turning 65. I give you an example. Let's say you turn 65 in November. November 20th is your birthday. Then your Medicare will start November 1st. And you can enroll 3 months before, the months off, and also 3 months after. If you have Medicare before age 65 due to disability, you will have a second 7-month enrollment period where you can change your plan, or you can you enroll in another PDP plan. You can go into a supplement plan and with a separate prescription plan. Other important dates are, we already talked about the annual enrollment, which is coming up rapidly. There are special enrollment periods also available. And this is, for example, if you move out of the area, that will open up again an enrollment period where you can change your plan. Or let's just say we're thinking you might be eligible for Medicaid on top of Medicare, and the application is going through. That also will open up a special enrollment period. Then there is called open enrollment. That is from January 1st to March 31st. And in this time period, you can change your Medicare Advantage plan one time. You also can go from your Medicare Advantage plan to back to original Medicare and a prescription plan. Now, Medicare Advantage and Veterans Healthcare. These are actually two completely different things. The VA healthcare covers care from a VA provider and a facility. VA providers and facilities will not accept your Medicare Advantage plan. With a few exceptions, Medicare-approved providers typically don't accept your VA healthcare. So Medicare Advantage and VA healthcare do not coordinate their benefits. The VA cannot bill Medicare, and Medicare cannot bill the VA. When you have both a Medicare Advantage plans and your VA coverage, you have actually more coverage and care options than just on the VA coverage. Medicare Advantage plans may provide additional benefits on top of it. So it is time to think about, when it is time to think about, which is coming up, what Medicare choices you have. Here are a few ideas you really should consider. One is cost. How much will you pay for premiums, for deductibles, co-insurance, co-pays? Are you additional benefits included, such as prescription coverage? Are your doctors in the network? Are the doctors conveniently located for you, especially out here in our rural areas in Kentucky? Very important. Have you need care in the past few years? Do you anticipate that your medicine needs will increase? Do your doctor prefer healthcare facilities? Will they accept the plan? Do you have a chronic condition? Will your future healthcare needs grow? What about your prescription needs? Will they increase in the future? Will the prescription drug coverage cover these extra expenses? How much will be covered? Do you need more coverage than original Medicare? Maybe a supplement is something to think about. Then, and this is something very specific to my veterans families, and it's called CHAMPVA. To be eligible for CHAMPVA, you cannot be on Tricare. That is one thing that is important to know. But you need to also be at least fall under one of the following categories. And that is, you have to be a spouse or a child of a veteran who has been rated permanently and totally disabled for service-connected disability by a VA regional office. Or the surviving spouse or child of a veteran who died from a VA-rated service-connected disability, or the surviving spouse or child of a veteran who was at the time of death rated permanently and totally disabled from a service-connected disability, the surviving spouse or child of a military member who died in the line of duty, not due to misconduct. In most cases, these family members are eligible for Tricare and not CHAMPVA. And again, if you are eligible for CHAMPVA, you cannot be on Tricare. CHAMPVA and Medicare, how does that work? To be able to continue to receive CHAMPVA benefits after age 65, you must meet following conditions. If you turn 65 on or June 5th, 2001, you must be enrolled in Medicare Part A and B to remain eligible for CHAMPVA. If you turn 65 or older prior to June 5th, 2001, and were otherwise eligible for CHAMPVA and were entitled to Medicare Part A coverage, then you may be eligible for CHAMPVA without having to have Medicare Part B. If you turn 65 before June 5th, 2001, and have Medicare Part A and B, you must keep Part A and B to be eligible for CHAMPVA. I hope that helps a little bit. Then I'd like to address briefly Tricare for Life. It is a premium-free Medicare wraparound coverage for Tricare. The beneficiaries will have to have Part A and Part B. Typically, these are military retirees, their spouses and dependents. Again, you will need to have your Part A and Part B. To retain your Tricare for Life and be eligible for Medicare, you must enroll in Part B at the age of 65 or when you're eligible for Tricare for Life. And this offer may complete coverage. It includes Part D, like the drug. Medicare is the primary insurer and Tricare for Life is the secondary insurer. There is no enrollment fee for Tricare for Life, but you do need to keep paying your Part B monthly premium. Here are a few helpful resources. Medicare and You Handbook. Everybody who is on Medicare or is turning 65 will receive a Medicare and You Handbook, and they have been sent out for 2021. I always say, please keep that handy. There is a lot of good information on there. To see if you qualify for additional benefits, it's to contact your Medicaid office, food stamp office, Social Security office. And I know this is difficult right now during COVID. So again, I'm more than glad to help you with applications for your Medicaid. We can submit that online. Extra help for your prescriptions, for example, it's called low income subsidy. These are applications, they could be done online if you cannot get into the food stamp office. Then there is the CHAMPVA number. Again, if you need these numbers later posted, more than glad to do this. There is the state health insurance program, Tricare, the National Association of County Veterans, and the VA health care benefits. I would like to address a couple things here when you get ready to decide what's working for you, what is in your personal situation. That is actually one thing I see a lot in with my clients. They always ask me, well, I want the best plan. It's not really, you cannot say that, because every single person has special needs and, you know, special questions and certain situations where they say, okay, this is important for me. Other people have other scenarios that are important for them. So it is a very individual choice. If you pick a Medicare Part D drug plan or a Medicare Advantage plan, a supplement plan, you know, they will have often separate premiums from original Medicare. If you want more coverage than original Medicare provides, you always can go with a Medicare Advantage plan, a prescription, a supplement plan. The main thing is that you need to think about what covers your needs and also what can you afford, what price will work for you. Your cost depends on the coverage you choose. Medicare Advantage plans cost depend on whether the plan charges a monthly premium or not, pays any of your monthly Part B premiums, or includes co-pays, co-insurance, deductibles, etc. Keep in mind, not all plans are available in all areas. It depends on your zip code and your county. Original Medicare supplements and Medicare Advantage plans cover certain preventative services. Medicare Advantage plans are required to cover everything what original Medicare covers. So, and this is something what I see a lot, when you make a decision, it has to fit your budget. You know, everybody I work with is on a fixed income. So we need to take that in consideration. Money is mattering. And also we need to make sure that your health is covered. You have some control of what you will be spending with the choices you're making. You can add supplemental benefits if you want to. Now, Medicare Advantage plans often have a fitness and rewards program, over-the-counter benefits, neighborhood centers with classes and informations in many areas. I appreciate, again, your service and for listening today to me. I hope I covered quite a bit of your questions. If I did not, please send us a PM, text message, and I will show you real quick. Here is my information. I appreciate that. Thank you very much. And I'm looking forward to seeing you next month. And I think I will cover cancer and Medicare. And back to Nicole.
Thank you, Sasia, for today. It was a lot of great information. And like Sasia said, she has her information here. We'll post those, that information that she talked throughout the presentation on there. So if you need anything from her or from us, you can contact the Bath County Extension Office, and we will see you next month.
Thank you. Have a good one.